and I hate to be morbid, but if the hospital home care program wasn't in effect in her life, I don't think she would be here.
The American Academy of Home Care Medicine began as the American Academy of Home Care Physicians in the mid-1980s, when a group of forward-thinking physicians helped spark a new movement of home care medical providers. The new academy was established to serve the needs of thousands of physicians and related professionals and agencies interested in improving medical care of patients in the home.
The physicians who started the academy had recognized that this is really an important service for patients, and so wanted somebody to be standing up and advocating for that involvement. In its very earliest days, a membership organization with, I think, 10 or 15 members in the office that had its box records in somebody's garage and borrowing somebody's secretarial operating budget of a few $100s a year. There were some predecessors to Alan and Joanne. There was Paul Hankwitz and Joe Keenan, who were among the very earliest leaders, and then Joanne, who was remarkable and one of the most important early leaders of the organization because of her role as well at the AMA, where she'd been so central in developing geriatrics as a focal point in the AMA. Alan picked up, and he had the unique qualities of being a pediatrician, so we had really widened the scope of our programmatic approach to include all ages.
AAHCM has been in the forefront helping to foster the development and growth of the field. Achievements include key reimbursement victories and passage of legislation creating the Independence at Home demonstration.
So the first victory, of course, was the Medicare fee schedule, which we tackled for house calls and then domiciliary and assisted living visits between 1995 and 2001. We were remarkably successful. We got the total payments more than doubled.
Academy members have also championed new technologies to make home care much more effective. These tools include mobile x-rays and lab work and have been known to wow those not familiar with the technology.
The wow factor in medicine is really kind of the basic tools of an emergency physician that are now, instead of being big complex machines, you carry them in your pockets. They're small, inexpensive, and easy to use. Back in the 80s, we were building complex vans to develop wet film in people's driveways, and you need a modicum of lab tests. There are about 16 key lab tests, so we bought machines and put a generator in the van to run the x-ray processor and the lab test machines, and we really had an emergency room on wheels.
Now I go to somebody's home, I can have all of the data that I need, the laboratory data, the vital signs, everything else that I need to do a good job of taking care of that patient. I can have them at my fingertips. Right now I'm seeing the patient. I can have them sent to me electronically through the ether at any point in time that I want. We have got the technology.
One of the reasons home care medicine is so successful is because of the approach. Many programs operate with interdisciplinary teams. Academy members not only include home care physicians, but nurse practitioners, physician assistants, and social workers.
I think PAs are important to the model of home care because, again, we are very much trained in a generalist model. We are taught to think more about the entire person versus the disease management of the person. In other words, it's not so much what's the matter with the person as what matters to the person.
I think nurse practitioners tend to have a different view of the patient. We have the luxury really in our education of learning some of the traditional medical care, but also the nursing perspective, looking at families, looking at environments. And I think that is very, very important in the delivery of home care.
We all have psychosocial needs. We all have basic needs of food and shelter and emotional health. And those are compounded when you're dealing with chronic illness, caregiving responsibilities, other life stressors. And so as a social worker, we try to help process those stressors. We try to help minimize them and build supports and link people to resources so that they can thrive and do the best that they can.
Although the Academy has made great strides, it still faces challenges. Even with these challenges, the Academy continues to grow and looks forward to the challenges ahead.
I think the greatest challenge, this is such rewarding work, and the greatest challenge has been payment reform. Doctors doing this are not looking to get rich, but they need to pay the bills, and so we need to help them to be able to do that.
The time has come to enact Independence at Home as a permanent Medicare and Medicaid benefit, and it's time we stop denying the Medicare and Medicaid beneficiaries the care that they really need, which is health care as it used to be provided, and that is by having a physician come to your home rather than you coming to the physician's office.
I think we need to create that vision for what the future should look like.
And you can create the clinical team, the mobile technology, the treatments that bring care to them in their home and can essentially solve both their problem and the healthcare biggest healthcare challenge that our country faces. So you can be part of solving the biggest challenge in the healthcare system.
You know, when I think of the Academy, I think of the childhood book, The Little Engine That Could. It is a small organization that literally has done extraordinary things. I truly believe we are the future of healthcare, and our healthcare system depends on us spreading home care medicine.